We present the case of Axenfeld-Rieger syndrome in a 41-year-old male patient
with progressive visual loss since the age of 19.
Anterior segment present posterior embryotoxin, aniridia, and trabecular dyskinesia.
His mother has a history of bilateral aniridia. His visual acuity was hand movement in both eyes. Due to the presence of advanced lens opacity consistent with cataract, we perform phacoemulsification surgery. Under general anesthesia and strict aseptic conditions, paracentesis and the main corneal incisions were performed. Triple blue dye was then carefully injected into the anterior chamber to stain the anterior capsules and change visualization. Dye was gently aspirated and additional viscoacid was injected to maintain chamber stability. A continuous curvilinear capsulorhexis was performed using Cataract followed by a gentle hydrodissection to ensure nucleus mobility. Phacoemulsification was carried out to fragment and emulsify the lens nucleus, taking care to preserve the posterior capsule integrity. Cortical remains were aspirated using the irrigation aspiration handpiece and the posterior capsule thoroughly polished. After that, viscoacid was reintroduced into the capsular bag and a foldable intraocular lens was implanted in the capsular bag. At the 24-hour follow-up, the intraocular lens was well centered and positioned within the capsular bag. 1 week later, cataract surgery was performed on the right eye. We performed a paracentesis using 15 degrees blade and introduced triple blue to the stained anterior capsule. Viscoacid was then injected into the anterior chamber. The main incision was created with 2.2 mm blade. A continuous circular capsulorhexis was performed using the Trata forceps. Hydrodissection was carried out to ensure proper nucleus mobility using the phaco handpiece, and a central growth was sculpted to perform stop and chop technique. All nuclear fragments were carefully removed while preserving the posterior capsule. Cortical material was aspirated with the irrigation aspiration handpiece. Viscoacid was reinjected and a monofocal intraocular lens was implanted into the capsular bag. At the 24-hour follow-up, the intraocular lens was well centered and positioned within the capsular bag.